Yes, so this meeting we're also providing an update of the master trial that was previously published on JCO. Now we're presenting an update with 34 months of follow-up. And what we're seeing is essentially a confirmation of what had been initially published, that with this approach with Dara, carfilzomib, lenalidomide, and dexamethasone, transplant, and MRD-guided response-adapted consolidation and cessation of therapy, the majority of patients, now 81% of the patients, can achieve MRD negativity to 10 to minus 5. And the majority of the patients, in this case 71% of the patients, were able to discontinue therapy. With longer follow-up, we also learning that the vast majority of the patients with no high-risk chromosomal abnormalities or one single high-risk chromosomal abnormality have done well. They remain free of treatment and free of progression. For the patients with 2+ high-risk chromosomal abnormalities, you have a higher rate of progression in general for the cohort, but also on those who cease therapy. But even then, the overall survival at 2 years is still 100%. So most of those patients who go on to cease therapy, even if they evolve with progression of loss of MRD, negative response, that the control of disease is reached with subsequent therapy. So I think in general that puts an emphasis on the need to not only do more extended therapy for patients with ultra-high-risk myeloma, but really innovate on those patients by deploying new modalities of therapy early on. But conversely, for the vast majority of patients who fortunately do not have ultra-high-risk disease, this starts to confirm a path to deep remission that lead patients to be free of therapy.